Hello everyone. Welcome you all to Sri Jayendra Rank Zone classes. I am your mentor and your friend for the subject chemistry, and I will be taking the organic chemistry. My dear students, in the last video, in the last lecture, we have started chemistry in everyday life. We discussed the classification of drug and its different criterias on which the classification is based upon. We were discussing analgesics. These analgesics, they are classified into non-narcotic and narcotic drugs. Narcotic drugs we are going to start today. So today's topic is narcotic drugs. Narcotic drugs, there are certain analgesics, okay? I mean, I should say there are certain narcotic drugs which are having the analgesic action, okay? Drugs which produce sleep means hypnosis and unconsciousness. Also have analgesic action or effect, and they are known as what? The narcotic analgesics. For example, morphine, okay, it is a potent analgesic which is used, okay, morphine and its derivatives. Okay, like codeine, heroin, marijuana. They are used in severe pain, are used in severe pain as analgesics. Understood? These drugs are habit indulging drugs. These drugs are habit indulging drugs, and when they are used under medical supervision, they are mainly used as analgesics and sleep inducers. But excessive dose can act as poison. Okay? They are also referred as opiates or opiate derivatives, opium derivatives, as opiates. Okay? Poppy somniferum is a plant where this is extracted. Poppy plant. Okay, understood? Narcotic drugs, they are used during cancers, pain during cancer, post-operative pain, when after any surgery, in case of angina, cardiac pains. Okay, understood? Also used sometimes to reduce labor pain. Now, next is tranquilizers. These substances are used for the treatment of stress, fatigue, mild and severe mental diseases. Okay, so the drugs which are used for treatment of stress, fatigue, mild and severe mental diseases, they are known as what? Tranquilizers. They are, these drugs are neurologically active. They are neurologically active drugs, okay, which affect the transmission of nerve of nervous stimuli, means the message from nerve to receptor. Okay, they are used to release they are used to release mental stress and reduces anxiety. And reduces anxiety. They are important constituents of sleeping pills. Okay, they mainly act on CNS, central nervous system, and they are also known as psychotropic, psychotherapeutic, psychotherapeutic drugs. These drugs make the patients passive and control their emotional distress or depression. Okay. Now, examples of these tranquilizers: noradrenaline, noradrenaline is also a neurotransmitter and helps to changing of mood. Okay. This noradrenaline also show antidepressive effect, to show antidepressive effect. Okay. Drugs which inhibits the degradation of or decomposition of noradrenaline are used as tranquilizers. Okay. Now, examples: phenalzine, then heproniazid. Phenalzine and heproniazid, they are the examples for these tranquilizers. Okay. Most commonly used tranquilizers are the barbiturates, commonly used tranquilizers, barbiturates, and its derivative like amtelenol, second. Okay. Barbiturates are hypnotic agents, means sleep inducing. That is sleep inducing. Okay. There are some non-hypnotic tranquilizers as well which are used. Chlorodiaphane oxide, sorry, and maprovimate. Okay, so they are non-hypnotic tranquilizers used as a tranquilizers mean to reduce the level of tension and depression. Equinil, it's an important tranquilizer. Okay, used in depression and hypertension. Okay, so these are the tranquilizers. Valium, serotonin, they are also tranquilizers. Valium, serotonin, they are also tranquilizers. Okay, now comes the antiseptics and disinfectants. Just give me a minute. So, antiseptics and disinfectants. Antiseptics, they are the chemical substances which are used to kill or to arrest the growth of microbes like bacteria, virus, fungi, okay, on living surfaces. So antiseptics, they are basically for living surfaces and they are the chemicals which are used to kill or arrest growth of microbes. Disinfectants, the action is same, but they require large concentration of the compound or the chemical agent. Secondly, and can be used or applied only on non-living surfaces. Non-living surfaces. Is it understood? Okay. Some common examples of antiseptics are soframycin, Dettol, okay, for disinfectants, Lysol, okay, phenol, especially 1% of solution of phenol act as disinfectant, okay, and 0.2% solution of phenol act as antiseptic, okay. Chlorine powder, it is also used as a disinfectant, okay, at a concentration of zero point 0.2 to zero point 0.4 parts per million, okay. Dettol is an antiseptic and it consists of and it is a mixture of chloroxylenol and terpenol, okay. So Dettol, it's an antiseptic and it is a mixture of chloroxylenol and terpenol, okay. Chloroxyl Chloroxylenol impose both antiseptic and disinfectant property. Understood? Then comes bithanol. Bithanol is an antiseptic and is added to medicated soaps, okay. It helps to reduce the smell, help to reduce smell or odor produced by bacterial decomposition, produced by bacterial decomposition of organic matter on skin, okay. Then comes iodine. It's a powerful antiseptic. It is used as tincture of iodine, which is basically 2 to 3% of iodine solution in alcoholic water. Okay, so iodine is basically a powerful antiseptic. It is used as a tincture of iodine, which is 2 to 3% of iodine solution in alcoholic water. Okay, or alcohol. Low concentration of sulfur dioxide also act as sterilizing agent, helps in prevention of fruit juices and squashes. Okay, boric acid shows weak antiseptic properties. Okay, you can see or you can find is as an ingredient of baby talcum powder, boric acid. Iodoform, iodoform test, iodoform, they are used as antiseptic powders for wounds. Okay, hydrogen peroxide, it is a non-irritating strong antiseptic. I mean it doesn't causes irritation or burning sensation, okay, in the skin. H2O2. Hexachlorophene used in soaps, creams, emulsions. Okay, it also acts as a antiseptic. Amyl cresol or metacresol, it is also an antiseptic. Used in mouthwashes. Okay, thymol, it's a natural occurring phenol. Okay, it is more powerful disinfectant than phenol. Okay, there are some dyes as well like Genesian violet and methylene blue. They also have antiseptic properties. Okay, so these are antiseptics and disinfectants. Now coming to next, antiprotozoal drugs or anti-malarial drugs. In antiprotozoal drugs, there are different types of drugs. We are going to talk about the anti-malarial drugs. They are used for the treatment of malaria. Example, quinine. Okay, it's a natural alkaloid. Chloroquine, paraquine, and primaquine. They are also the anti-malarial drugs, okay, which are used against malaria. Okay. Then comes the antimicrobials or antibiotics. These are the drugs which help to cure infection causing or infection or infectious diseases. Okay. Infectious diseases. These infectious diseases are caused due to pathogens or pathogenic diseases. Understood? Antimicrobials or antibiotics, they work against the biochemical pathways of microbial agents, means like bacteria, virus, fungi, such as cell wall, cell wall repair, and its formation. Okay. So antibiotics, they have a specific or they follow a specific biochemical pathway of a microbial agent through which the microbial agent develops a particular resistance or a particular, I mean, it can make a cell wall or repair its cell wall, okay, or reform its cell wall. Okay. Now, these antibiotics or antimicrobial agents are present both in natural forms or they are synthetically administered or synthetically prepared, like natural antimicrobial agents, lysozyme secreted by saliva, tears, also show the antimicrobial action or bactericidal action. Okay. Then comes sebaceous gland secretes sebum, which also act as a antimicrobial agent. Hydrochloric acid, Okay, now two types. One is bacteriostatic. Bacteriostatic and bactericidal. Bactericidal, they are the drugs which kill the organisms in the body. Bacteriostatic, which inhibit or arrest the growth. Okay, bacteriostatic and bactericidal. These drugs, they also help to increase the levels of immunity. They also help to increase the levels of immunity and disease resistance power. Understood? Is that clear? Now, antimicrobial drugs or antibiotics, they are of different classes. I mean, they are being divided into different categories. Okay. Paul Ehrlich, he was a German bacteriologist, investigated a arsenic-based structure in order to produce a less toxic substance for the treatment of syphilis. Okay, Paul Ehrlich produced an asbestos-based, substance. Okay, for treatment of syphilis. Okay. After that, there are many discoveries. Okay. There are some azo dyes which are also used as a antimicrobial agent. Okay. Prontocell was the first antimicrobial agent, antibacterial agent, sorry. Okay, synthetically prepared. Sulfonamides, they are also synthetic. And antibiotics like penicillin, chloramphenicol, They all are natural. Tetracycline is also natural. Okay. Sulfonamides are analog of para amino benzoic acid. Para amino benzoic acid. Okay. Means the structure will be okay. Sulfonamide, large number of derivatives of sulfonamide such as sulfadiazine, sulfadimidine, they are being used as antimicrobials, and one of the most effective is sulfapyridine. Sulfonamides, when they are combined with trimethoprim, they are used as a treatment of infectious of urinary tract infection. Work against. Okay. Then comes anti-fertility drugs. They control the pregnancy, unwanted pregnancy. They control unwanted pregnancy. Okay. They are also known as oral contraceptives. These drugs prevent fertilization, prevent conception, and that is why they are known as birth control pills. Got it? These drugs mainly control ovulation or fertilization. Example, they mainly contain progesterone and estrogen. Okay, or their derivatives. Now comes some common examples: novestrol, Okay, mifepristone, it is also known as morning after pill in many countries. Okay, or meloxifene is also a anti-fertility drug which is developed in Central Drug of Research Institute, Lucknow. So these were the oral contraceptives which basically prevent the unwanted pregnancy, okay, by tempering the ovulation or by fertilization. We discussed about antimicrobials. Antimicrobials also include antibiotics. There is a huge classification of antimicrobials under which these antibiotics are there. So these are the chemical substances which are produced by one organism, produced by one organism to kill or to arrest the growth of other organism of the other organism. Like Alexander Fleming, he discovered penicillin. Penicillin is basically extracted from a fungi, Penicillium notatum. Okay, so the chemical substances produced by one organism to kill or arrest the growth of the other organism is known as what? Antibiotic. Okay, they are very commonly used to retard the growth, to inhibit the growth, and even to destroy these microorganisms. Okay, like bacteria, virus, fungi. Viruses, for viruses we use antiviral drugs. Okay, and for fungi we use antifungal drugs. Okay, antibiotics, they basically attack the biochemical pathway of microorganisms. Okay, Alexander Fleming in 1929 discovered penicillin C9H11O4 SN2R. Okay, depending upon the nature of R group, categorization of penicillin is done. Okay, like penicillin G, the nature of R group is substituted toluenes. Okay, or benzyl compounds. Understood? Same we have penicillin F, K, V, ampicillin. Okay. This is ampicillin. As we have already discussed about bactericidal and bacteriostatic. Okay. Like penicillin, aminoglycosides. Okay, which includes streptomycin, ofloxacin. They are bactericidal. Okay. Erythromycin, tetracycline, and chloramphenicol are bacteriostatic. Okay. Based on the wide range of their action, they are classified. Antibiotics are classified into broad spectrum and narrow spectrum. Broad spectrum antibiotic, broad spectrum antibiotics, they are effective against many species of bacteria, okay, or microorganism, effective against several types of microorganisms. Okay, example, tetracycline, chloromycetin, chloramphenicol, mycetin. They are broad spectrum antibiotic. Okay, chloramphenicol is also broad spectrum antibiotic. Broad spectrum antibiotic. Okay. Penicillin is a narrow spectrum antibiotic which cannot be used against different types like penicillin. It comes under narrow spectrum antibiotic. Okay, effective effective against only limited species or types. Okay, sulfa drugs. Sulfa drugs, they have great antibacterial powers. Okay, effective against pneumonia infection, tuberculosis, diphtheria, etc. Okay, examples are sulfadiazine, sulfonamide. Okay, they are the sulfur drugs. Sulfonamides we have already done. Antacids we have already done. Okay. Antihistaminics I have already explained. Okay. These drugs they act as a desensitizing agent against allergic reaction. Okay. They work against act against the release of histamine, which is a chemical mediator for causing allergic reactions. Okay, so histamine is basically a chemical mediator which is responsible for causing the allergic reactions. So, as we have already discussed, that histamine is a potent vasodilator and bronchoconstrictor. Okay, so antihistaminics they work against the release of histamine. Examples: terfenadine under the name Seldane, bromophenylramine. Okay, it also includes anti-allergic drugs, all anti-allergic drugs. Okay, promethazine is also very common example. Understood? Last is anesthetics. They can be divided into local anesthesia and general anesthesia. Local anesthesia, it includes 2% of lignocaine, and general anesthesia, it includes the nitrous oxide, ether, they all are the general anesthesia. Okay, chloroform also come under this category. My dear students, we have discussed about the drugs, and in the next lecture, I will be talking about the soaps and detergents, which will be the last soaps and detergents and preservatives. Okay, so till then, bye bye. Take care, stay safe, stay healthy.